1. When developing an MRI safety training curriculum for new technologists, which principle of adult learning should the Magnetic Resonance Safety Officer, MRSO, prioritize? A. Emphasizing rote memorization of terminology. B. Highlighting passive listening through lectures. C. Connecting safety concepts to real-world scanning experiences. D. Relying solely on pre-recorded video demonstrations. 2. During an evaluation of staff MRI safety knowledge, which method provides the most reliable measure of competency? A. Verbal self-assessment interviews. Observation of real-time MRI room practices. C. Written multiple-choice quizzes alone. D. Group discussions without structured grading. 3. Which of the following best illustrates curriculum development tailored for MRI safety compliance? A. Designing modules that strictly follow textbook order. B. Building modules around common safety incidents and case studies. C. Limiting the content to only manufacturer guidelines. D. Reducing content to minimize testing requirements. 4. A senior MRI technologist is mentoring a junior staff member. The most effective mentoring technique for safety compliance is A. Allowing the mentee to observe without asking questions. B. Providing feedback only during annual evaluations. C. Using guided practice with immediate corrective feedback. D. Delegating unsafe tasks for experiential learning. 5. According to regulatory compliance, which step must be documented when non-MR personnel require temporary access to the MRI environment? A. Verbal assurance that they understand risks. B. Written acknowledgement of MRI safety screening. C. Informal briefing conducted on the spot. D. No documentation required if under supervision. 6. An MRSO designs an evaluation tool to assess MRI safety culture in the department. Which format is most effective? A. Anonymous staff surveys with both quantitative and qualitative items. B. A single open-ended essay question. C. A checklist signed only by supervisors. D. Weekly staff attendance logs. 7. In curriculum design for MRI safety, how should the MRSO ensure compliance with the Joint Commission standards? A. Provide annual mandatory education with documented competency assessments. B. Allow staff to opt out if experienced. C. Replace formal training with email reminders. D. Focus only on newly hired staff. 8. A patient with a non-MR conditional pacemaker accidentally enters Zone 4. Which communication strategy should the MRSO emphasize when debriefing the incident with staff? A. Blame assignment to deter future mistakes. B. Encouragement of open, non-punitive reporting of errors. C. Limiting discussion to supervisory staff only. D. Ignoring the incident to prevent anxiety. 9. When evaluating MRI safety drills, which criterion best reflects adult learning evaluation principles? A. Staff retention of factual knowledge only. B. Staff demonstration of safe practices under realistic conditions. C. Frequency of attendance in the drills. D. Supervisor satisfaction ratings. A key mentoring role of the MRSO is to A. Dictate policies without discussion. B. Encourage independent critical thinking in junior staff. C. Withhold safety strategies until emergencies occur. D. Focus mentoring only on technical image acquisition. 11. To comply with ACR guidance, the MRSO must ensure that which staff group is trained in MRI safety annually. A. Only MRI technologists. B. All staff with potential MRI zone access. C. Only attending radiologists. D. Only biomedical engineers. 12. Which adult learning strategy is most effective for teaching MRI safety to interdisciplinary teams? A. Competitive memorization drills. B. Interactive simulations of MRI emergencies. C. Isolated study without group work. D. Repetitive written definitions. 13. Which best describes the MRSO's responsibility in mentoring newly appointed MR technologists? A. Ensuring consistent reinforcement of safe practices through coaching and feedback. B. Leaving training entirely to academic programs. C. Restricting mentoring to procedural checklists only. D. Providing no mentoring once initial training is complete. 14. An evaluation report shows that staff knowledge scores are high, but unsafe behaviors still occur. What is the best curriculum response? A. Reduce safety content to prevent overload. B. Incorporate behavioral simulations and scenario-based training. C. Increase multiple choice testing frequency. D. Focus only on written policies. 15. In mentoring, how should the MRSO best address a mentee's repeated safety errors? A. Use constructive feedback with specific examples. B. Issue punitive measures immediately. C. Avoid further mentoring responsibility. D. Ignore minor errors to build confidence. 16. Which communication method is most effective for reinforcing MRI safety culture hospital-wide? A. Posting annual safety bulletins in hallways. B. Real-time reminders and consistent policy updates via multiple channels. C. Informal word-of-mouth updates. D. Only sending quarterly email memos. 17. A key competency that must be evaluated during MRSO certification is A. Ability to interpret MR images. B. Knowledge of electromagnetic physics in patient care. C. Proficiency in MR safety screening and risk assessment. D. Mastery of advanced MR sequence design. 18. Which principle of adult learning is demonstrated when MRSOs allow staff to reflect on prior safety experiences during training? A. Motivation through extrinsic rewards. B. Building on learners' existing knowledge and experiences. C. Isolating prior experiences to prevent bias. D. Memorization without context. 19. A regulatory audit reveals incomplete MRI safety training records. The MRSO should first A. Notify staff to re-sign old attendance sheets. B. Develop corrective action with complete retraining documentation. C. Ignore missing records if verbal confirmation exists. D. Shift responsibility to HR alone. 20. A major goal of MRSO mentoring programs should be A. Creating long-term professional accountability in MRI safety practices. B. Delegating responsibility away from the mentor. C. Reducing the number of mentees trained to minimize workload. D. Limiting mentoring to technical staff only. 21. Which evaluation method is best aligned with competency-based education for MRI safety? A. Written test scores alone. B. Practical demonstration of screening and zone control. C. Attendance-based pass-fail. D. Peer evaluation surveys only. 22. The most effective communication technique when explaining MRI emergency evacuation procedures is A. Use of complex technical jargon to emphasize authority. B. Clear, concise language supported by visual aids. C. Limiting discussion to text-only policy documents. D. Assuming staff will learn procedures independently. 23. What is the most critical regulatory compliance step before installing new MRI equipment? A. Reviewing patient throughput projections. Ensuring site planning meets ACR and IEC safety standards. C. Training radiologists in advanced imaging. D. Scheduling the first accreditation inspection. 24. In curriculum development, how should MRSOs address diverse learning styles among staff? A. Use only one standard lecture format. B. Provide multimodal resources including simulations, readings, and discussions. C. Focus solely on auditory delivery. D. Minimize interactive content to save time. 25. When evaluating an MRI incident report system, which factor best ensures regulatory compliance? A. Reports are voluntary and anonymous with systematic follow-up. B. Reports are verbal and not logged. C. Reports are reviewed only by senior management. D. Reports are destroyed after each quarter. 26. During mentoring, which approach best models MRI safety leadership? A. Consistently demonstrating best practices in front of mentees. B. Criticizing errors publicly to enforce compliance. C. Avoiding involvement in day-to-day operations. D. Using passive observation only. 27. Which MRI safety principle must the MRSO prioritize when training staff on ferromagnetic detection systems? A. Importance of daily function checks and documentation. B. Encouraging staff to bypass alarms for efficiency. C. Limiting use to visitors only. D. Testing only during annual inspections. 28. What is the primary role of the MRSO in communication with senior leadership? A. Reporting MRI utilization statistics only. B. Advocating for resources and policies that uphold MRI safety standards. C. Avoiding communication to reduce accountability. D. Delegating all reporting duties to technologists. 29. Which evaluation principle ensures the validity of MRI safety training assessments? A. Assessments measure knowledge and behavior aligned with real-world scenarios. B. Assessments prioritize staff satisfaction over performance. C. Assessments are identical for all healthcare roles regardless of responsibility. D. Assessments focus only on theoretical knowledge. 30. Which regulatory compliance practice is critical when screening non-patient individuals, e.g. contractors? A. Assuming they are safe if supervised. B. Performing full MRI safety screening and documentation. C. Limiting access without screening. D. Allowing access during off hours. 31. An MRI quench occurs unexpectedly. The MRSO's communication role post-event includes A. Immediate reporting to regulatory agencies and staff debriefing. B. Ignoring the incident if no injury occurred. C. Informing only the vendor service engineer. D. Waiting until the next safety meeting.